of the Social Services Committee to order.
Thanks.
We'll talk next.
Okay. First item of business is approving the previous minutes. Can I get a motion to approve?
Motion.
Mr. Clay, second Mr. Camiso. All in favor?
Aye.
All opposed? Pass unanimous. Okay, item number 1 on the agenda is authorizing agreements regarding transportation for children with special needs to education and therapy programs. Commissioner Gehagen?
Yes, good evening, everyone.
Good evening.
So the department respectfully requests legislative approval to enter into a contract with Raja for the provision of transportation for children with special needs. The current contract with Raja ends as of August 31st, and this is the third year of a 3-year contract, and so we issued an RFP. Raja was actually the only provider that responded to the RFP, and based on their budget in terms of the associated costs that they presented, in terms of the number of buses to transport the increased number of children, as well as to comply with regulations regarding the number of monitors on the bus, as well as costs associated with gas and things along those lines, the total contract at going into 2018 would be $5,525,064.
Thank you. Any questions from the committee? Mr. Bullock?
Yeah, Raja is the only bidder on this. Is there anybody else that is a competitor out there that we've had previously that has bid on this?
Raja was the sole provider for the last 3 years. Prior to that, there was Northland as well, who was a provider. When the RFP was issued, it went out on the BidNet system, as well as there were individual notice to those companies that had previously or were in a capacity to be able to provide this service. Thank you. And Raja was the only one that responded.
Thank you.
Any other questions, Ms. Lockhart?
There was problems with Northland, wasn't there?
There
A lot
were,
of problems, yeah.
yes, there were.
Thank you, that's all.
Any other questions from the committee?
Motion.
Second. Mr. Bullock, all in favor?
Aye.
All opposed? Pass unanimous. Item number 2 on the agenda, authorizing agreements with the New York State Office of Children and Family Services for the Children's Advocacy Center and SIDS of Pennsylvania, and amending the 2018 Department for Children, Youth, and Families budget. Commissioner?
Yes, thank you. So this is our contract with, for the Child Advocacy Center, and this is actually a 6-month extension. OCFS, it's actually in the 5th year of the CAC contract with our county, and so they have just issued the RFP, but don't anticipate that they're making those new awards until January of 2019. And so in order to continue to have those services available, have had a 6-month extension from August 1st to January 31st to allow for CACs to continue to operate. We are in the process of responding to that RFP, so this request is really to accept the additional funds for the 6-month extension to allow for the continued services at the CAC.
Thank you. Any questions from the committee? Ms. Lockhart?
Commissioner, is this just for the money to purchase the cribs for kids? Or does it also other costs?
No, there are other costs associated with it, in addition to also purchasing additional cribs.
Okay.
Any other questions from the committee? Okay, hearing none, motion to approve. Mr. Camiso? Second, Mr. Touchette. All in favor?
Aye.
Opposed? Pass unanimous. Thank you, Commissioner. Item number 3 on the agenda, amending resolution number 20 for 2018 regarding the expanded in-home services for the elderly program. Deputy Commissioner?
Good evening. Yes, the Department of Social Services is looking to revise our agreement for the number of home care agencies that we currently contract with for the extended home services for the elderly. We're looking to bring on Visiting Angels of New York, which is another provider. We currently have 14 providers and would like to add on a 15th. As you know, there's all home care crisis that's going on, and we're having challenges finding a number of home health aides, certified nursing assistants and whatnot to fill the need. This agency has indicated that they do have new aides on board that they'd be able to help us fulfill that obligation. We'll be utilizing the Medicaid rate, which they'll get from the State Department of Health. So we'd like to move forward and contract with them to fill some of the unfilled hours that we have currently on some of our cases.
Thank you. Any questions from the committee?
The crisis you alluded to, what is that?
The lack of, or the shortage of home care aides, home health aides, certified nursing assistants.
And-
It's a shortage across the state and across the country. It's not something that's local. So
Okay.
it's a challenge in recruiting individuals to work in this particular field. Most of it has to do with pay scales, and it also has to do with career ladders and things like that, which the state is investigating and looking at. So,
Is there a way to address it locally? Well, I mean, I guess you are kind of trying to address it locally with this measure, but is it a question of like what either the federal government or the state government is allowing to be paid in terms of the
yes.
hourly wage?
That's correct. There are certain restrictions based on regulation that only allows them to go up to a certain cap to pay staff. And because of that, the incentives that are there are not enough to get people. I mean, you're talking, on average, a home health aide worker makes between $10 and $12 an hour.
Right.
But these are not RNs, though.
These are not RNs. These
Right.
are home health aides, certified
So, no.
nursing assistants, and things like that. The RNs is a whole nother that also has an issue in trying to make sure that they're filling those gaps as well. But there's a significant crisis in all of the home care industry, both from a non-paraprofessional and a professional.
I'm somewhat familiar with that because I have a disabled daughter who's now an adult, and my wife frequently is interviewing people to find replacements because that industry doesn't pay very well.
Right.
And it is our children we're dealing with, so.
Yeah.
Absolutely.
Do the state's minimum wage laws apply to home health aides, or are they exempt?
You know, that I don't know. That I can't answer, I would assume.
I would think so.
But even so, even though the state may pay them a certain wage, they have a lot of overhead and administrative expenses that they also have to deal with. So when it filters down to the actual work staff, it's not as much as you would think.
Okay, thank you.
I believe it applies.
Yeah, there's no
That's good,
waiver.
because it is
There's no
going
waiver
up.
on that.
Right.
It's going to take years, but
There
it's
is
slowly
with
going up to
restaurant
12.50.
employees, but not this.
Any other questions from the committee? Okay,
Make a
motion to
motion.
approve.
Make a motion.
Lockhart, second.
Second.
Mr. Reinhardt, all in favor? Opposed? Passed unanimous. Item number 4 on the agenda, authorizing submission of a grant application to New York State Office of Temporary Disability Assistance regarding a SNAP bonus award allocation.
So the Department of Social Services is asking permission to apply for this additional funding that the New York State Office of Temporary Disability Assistance is putting out across the state to local Department of Social Services to provide increased access to SNAP benefits. The application itself, although they've allocated certain funding streams to each of the local districts, we have to apply to prove our eligibility or award based on what we're looking to do at the local level. We're looking to apply for the full allocation of $102,893. With this bonus award funding, we're looking to obtain 4 kiosks. The kiosks, 2 will be placed internally at the Department of Social Services. The intent of the kiosks is for individuals to come in and apply for benefits through the My Benefits website for SNAP benefits, although they don't need to apply in person, and we'll give them an opportunity to do that. The primary purpose will be for individuals to come in and upload any documentation that they need to provide either as a new applicant or as a recertification. So we often get bundles of documents, at least 600 packets a month at a minimum for all of the SNAP recipients we have in Albany County. And these include, rent receipts, they include pay stubs, other identification that we're required to determine their eligibility. This will give the individuals who are receiving SNAP an opportunity to self-service and upload their documents right there rather than having to wait in line at DSS. To do it quickly, they'll get a receipt for the documents they did, upload, and then they can then walk away. We have 2 additional kiosks that will be put in the community. We're not sure where that will be. It depends on whether we get the award, and then we'll have to identify what that will look like. The funding will also provide us an opportunity to have the staff trained, because we will have staff available to assist clients in terms of uploading the documents. It will also provide us with scanners on their staff desktops, because we do get a number of documents through the mail, and we want staff to be able to upload those documents for recertifications quickly and accurately, so they can be put in our imaging system, so we can access that for any questions or case evaluation and assessment for recertification or processing for SNAP benefits. The third item that we'll utilize the money for is for a laptop and projector, because we'd like to go out into the community. We do a lot of outreach events. We get asked to participate in different events. We'd like to have the laptop available to assist people in applying with SNAP benefits while we're in the community, and also do some presentations with any of the providers that are out there, or any of the community-based organizations. And the final thing we'd like to do with the funding is to purchase some additional fraud software. It's called Accurint. Accurint allows us to purchase or run credit reports, credit checks on individuals who are applying for SNAP benefits. It will help us determine whether we can actually identify more fraud that's occurring in the SNAP program. So in total, the $102,000 is going to be for a multitude of infrastructure, technology-wise mainly, to help us really improve our operational efficiency and really kind of improve access to the Supplemental Nutrition Assistance Program.
Thank you. I think that's a great program. I'm glad that you sought out to install these kiosks. One question I have is for the fraud software. How does credit history relate to fraud? How do you detect fraud by looking at credit history?
Well, they'll look and make sure that the individual, if they have a number, if they're saying their income is one thing and then their credit is another, if you're purchasing a lot and you're able to pay your credit bills, like how do you have that much income but not enough income to purchase food? So they'll look at it from a variety of ways. There's a whole training mechanism that goes with that the fraud staff will attend a training session on to understand how to utilize that most appropriately.
Okay, thank you. Any question? Mr. Simpson?
Do you have a general idea where you would put the community kiosk in the Albany area?
We don't actually, we'll do an analysis of that to make sure that we're putting it in the, the highest.
Optimum.
Yeah, right, absolutely. So I think once we know that we're going to get the award, then we can then determine, we want to get the 2 installed internally first to make sure that they're working efficiently, that staff know how to utilize it, that the community participants know how to utilize it, and then we can then work at deploying them in the community so we can be effective, so they're being utilized most optimally, for sure.
You know, I guess what comes to mind, like a place like the major Albany library might be good, but then there's a question of, do you get an over influx of people that is congested? And so a place that optimizes access but not over, burdensome in terms of population.
Agreed.
So,
It sounds like you also would want to be in locations where there's someone who's trained to assist.
Yes, I mean, from what we've seen from the system, they're pretty easy to utilize, and they're pretty self-sufficient, but we will have staff that will need to go out and check on them and make sure that people have a way to access assistance as needed. So we know that we'll want to pick a place that also has someone who's trained on how to utilize that and provide technical assistance if necessary. So,
I assume in areas that people don't have transportation,
right.
such as this, the city of the buses, and right here, they can help, but some people in the hill towns.
Absolutely. Hilltop
Don't
was
have
one we had
access
thought
at all,
originally possibly as an option.
Mr. Brodeur?
Just out of curiosity, has anybody ever considered a mobile van or something where you could go to different locations? So you could be in the hill towns on one day and in front of the library another day, or down at a community senior citizen center another day?
Sure, some staff and some funding would help with that.
Well, I don't know what's involved with setting up a kiosk. You got to have a host.
Yeah, yes, we do, and we actually have to, you have to have internet connections, and because it is a web-based kind of system. And, this is the start of hopefully, something that will grow into other program areas. But right now, since the funding is available for this particular from the feds, that's, being filtered down to the state, they're giving us an opportunity to move in this direction. So we're hoping that if we're able to apply, we can be awarded the funding to at least start the process and see how it goes.
I just, following up on what Paul said, I think, although you know this better than I do, or others in the county know this better than I do, I think we do have some mobile services that,
Yep.
is there, it would be interesting to see if we could get a grant to add to what we're already doing, a component like this, where we along with things we're already doing, piggyback this kind of thing that Paul suggested into that. So maybe it goes up to the hill towns, or it goes to rural parts of the county, or just into urban neighborhoods, and publicizes, hey, here's a new thing we can do, and see if it works. Maybe it becomes something that can prove that it's got value, then we would find the money to do it ourselves.
Agreed.
Can you keep us up to date as you move along in the process of picking the other sites for this?
Absolutely.
This kiosk?
Absolutely.
Thank you.
I'll make a motion.
Motion, second?
Second.
Mr. Reinhardt, all in favor?
Aye.
Opposed? Passed unanimous. Thank you.
Thank you.
Can I have a motion to adjourn?
Yes.
Second? All in favor?
Aye.
Opposed? Meeting is adjourned. Thank you.